satiety as more of a guide towards portion sizes and meal frequencies. I think it's a better and more sustainable approach to rather than counting calories.
I'll just finish up on what you're saying by, in practice, essentially what we do is we give people a food list, and there's no portions, there's no calories, there's no macro targets or anything. And we just tell people, eat from the food list, especially when you're getting started. Like Tom said, listen to your hunger, listen to satiety. And it's a much more liberating way of losing weight, improving your health, and being able to adhere to a diet, and feel like you've got some kind of structure you can follow, but not one that involves rigid calorie counting, tracking, weighing, things like that. Would you agree with us?
Yeah, I hated counting calories, but I had some problem with you tend to become obsessed with how many calories and thing, and the food the calories that you eat in food, your body will use more or less of them, and you won't really be able to control that. You'll be able to go out for a run, maybe that uses a bit more energy. But are you aware of whether your hair grew 1 millimetre or 0.5 millimetre today? And that's a lot of energy differential between those two things, and you're not in control of that. So your body is going to run the process. So what you really want to do is give your body the signals, like as Tom was saying, insulin. It's going to be a significant signal. So
Great.
So the next question that I have is about protein. How much protein should I be eating? Who wants to take it?
I'll take it. Yeah. And again, it's another common question, and it's quite confusing. And people often do forget that protein is so important. I think it's important to understand that protein is the building blocks of your body. It's completely essential. It's an essential nutrient, meaning that your body doesn't make these proteins or all of your amino acids. And so to get it in a diet, it has to be one of your top priorities. Now, I think it's individualised for each patient particularly. And I work at a gastrointestinal clinic in Sydney alongside Dr Pran Yoganathan and Jess as well. And we often see patients, with inflammatory bowel disease, which are autoimmune conditions, and it's likely a lot of our patients have increased protein requirements. So to set a specific target for an individual, it does require a bit of assessment and taking into account people's absorption, particularly inflammatory bowel disease as well. So normally what I'm suggesting with protein is I'm asking people to prioritise protein number one at each meal. So and then add some fats to there, and then add your non-starchy vegetables on a low carbohydrate diet. Secondly, I'm asking people to increase their snacks as protein, so increase more protein-dense snacks. So I think most of my patients, are benefiting from more protein, and I think everyone will. I haven't rarely seen a case where someone is eating too much protein. So that's my general tip towards protein.
Yeah, and I think that in the dieting world, and this is true for the low-carb world as it is any other dieting world, we're always trying to think, what can we restrict? What can we have less of? And even in the low-carb world, it's in the name, right? Like low carb, let's restrict carbs. And not many people are talking about what we need to eat more of. And I think, we see a lot of patients where, they might have already been doing low carb on their own, and they come in and they're really restricting their portions of low carb foods, which are high in protein. So meat, fish, eggs, dairy as well. And some people are even counting their protein, like trying to restrict and not have too much at each meal. Whereas we haven't found that to be all that effective. And we might be working with populations that are not necessarily general, because we're working with a lot of chronic disease patients, but chronic disease is very common. And so we find that their protein requirements are just so high because their bodies are having to do so much more to heal, to repair, for their immune system and whatever it may be. So as Tom said, we're usually just increasing protein requirements for people. So there is no one single how much should you have, but listening to hunger and satiety is key. And if you're really unsure, like if you do have chronic disease or multiple factors affecting your absorption or utilization of protein, I would think about seeing someone who can do that assessment with you, like Tom was talking about. we spend an hour with our patients just asking them questions. And every answer they give us is going to determine, okay, what should their protein be? What should their fats be? What should their carbs be? What should their micronutrients be? And we don't then give them a number, we give them food and we give them practical advice. So we've got all the numbers in our head so that other people don't have to count and track and worry about that. But it does help sometimes to just have someone be able to do that assessment for you. So we're looking at things like people's goals as well. If someone wants to increase muscle, which a lot of patients do, then their protein requirements are higher. And what Tom was saying about making your snacks protein-based, oftentimes when people feel like a snack, even in the low-carb world, they're going for things that are like low in energy. So things like celery sticks, or they're going for carrot sticks, or they're going for berries, and they're thinking, this is great, I'm low-carb, I'm eating my low-carb foods. But they're kind of hungry between meals and they're going for these like carbohydrate, low-protein foods. Even though they're low in carbs, they're consistent with a low-carb diet, but they're not adding to your protein intake for the day. And I think there's a lot of people as well doing 1 meal a day or even 2 meals a day, and they're actually struggling to get the protein they need. So then sometimes doing like 3 meals or having a protein-rich snack, like Tom said, can help too. And yeah, we've never seen too much protein being an issue for people.
Okay, cool. So the next question that I have is, I'm eating a real food diet, and so real foods, and my carbs are very low, but I still can't lose weight. What do I do now?
Sure. And it is common. And I, again, to bring another example to the table, I do have patients that, start following a low-carb diet and they have great success early. And maybe 6 to 8 weeks down the track, they get a bit of a weight loss stall. So by this time, I'm encouraging people to think a bit more about meal timing, for example, and maybe even trialing some intermittent fasting. And like you covered before in your previous presentation, Richard, just keep the metabolic rate guessing. Keep the body guessing, not getting into a routine where you always have this set pattern where you're having breakfast, where you're having lunch, dinner, morning tea and afternoon tea, and consistently grazing on foods all day. So what the advice that I would give is to potentially try alternating days where you have 2 meals a day and then going back to your normal routine. When you're having these periods of intermittent fasting, your insulin levels are nice and low and you're metabolizing fat more efficiently on these days, and you're also fluctuating your calories too, which can come into play if you're eating like this store.
Mm-hmm. Yeah, cool. Yeah, so meal timing is a good one to think about. And I would also add looking at micronutrients as well. So what we generally do is after the first appointment, we get people to go and do a whole bunch of blood tests, which look at their metabolic markers, insulin levels, glucose levels, but also vitamin and mineral markers. So things like vitamin D, vitamin B12, vitamin B9, iron studies, inflammatory markers as well, as these can give us more of an idea of what types of foods we might need to recommend to people. And sometimes we need to use supplements as well. So a lot of people come to us and they're very, very low in iron, whether that's because their iron losses are very high, their iron absorption is very poor, or because they're just not eating a lot of iron in their diet because everyone is so scared of red meat. So we're finding iron deficiency is very common, and this can be a big barrier to weight loss. And so people with low iron generally have a very low energy output. They're very tired, they're very sluggish. Their body can't mobilize the same amount of stored energy because you need oxygen to do that, right? And so if you don't have iron, your oxygen carrying capacity is limited. And so this is a huge barrier for many reasons. And we don't really like to use iron supplements per se. But if someone is really, really low, a lot of the times we see people that are so low in iron, they need an infusion. So they need to go and do that straight away. Or they're so low, they need to use a mixture of supplements and real food. But in someone who had low iron, for example, we might talk to them about having red meat every single day, which to a lot of people sounds crazy, but that might be the thing they need to change in their low-carb diet to actually be able to boost weight loss and even just feel better within themselves. Because I find that people are so stuck on scale weight when they don't feel good in themselves. When you start to feel good within yourself and you're burning lots of energy and your mood is good, you don't care about the scale weight anymore, right? Because you've reached your goals, you feel great, and then the weight comes off as a side effect.
Okay, so the next question is macro tracking. Do you need to track macros?
Okay, so this is, I guess, similar to the calorie counting question. So do you need to track macros? This is a question pretty much, 60% of clients ask me, because people feel secure when they're tracking. Like when they're writing down their food, they feel like, I'm doing something right. I feel comfortable this way. And it's not just like left open for chance. And especially what we said before, like listening to hunger and satiety is not necessarily an easy thing to do. So sometimes food tracking and macro tracking can be beneficial. It's never the first thing we would recommend. So if someone's coming in from just a standard approach or they're eating lots of carbohydrates and we want to switch them over to a low carb diet, we don't talk about macro tracking. But if they've been doing the diet for a little bit of time, they've been trying to tune into hunger and satiety, and they're still not quite reaching their goals, whatever their goals may be, then we might do some macro tracking. And this is just diet tracking. So we might recommend that, you keep a food diary or write your food intake into an app, and then the app just tracks all your macros. For some people, we don't give macro targets and we just tell them to observe and learn and see what nutrients different foods have. Whereas for other people, we do give macro targets. We've never given calorie targets, but usually the macro targets are minimums. So we recommend to people have at least, 30 grams of protein with lunch and at least, 100 grams of fat across the day. And these are kind of like rough guides so people can build their main meals adequately. And if you're building your main meals adequately, then you're less likely to eat between meals. And that's when you can start to experiment with what Tom said before about reduced meal frequency or changing up your meal frequency if you're trying to lose weight. We do use macro tracking as a tool, but we certainly don't use it for 100% of our clients. And even if they are recommended to do some food tracking, we usually only say do it once or twice a week or do it 3 days and then give us a call and let's see how you go. And we help them review it so they're not kind of left in their own bubble just tracking their diet all day long. Did you want to add anything else?
Sure. I agree completely, and you pretty much summed it up. But I do think tracking macros is a really good tool to educate yourself on the contents of the foods that you are eating. And then maybe potentially, sometimes what I ask patients to do is track their macros 1 day a week. So then when they are, looking at achieving certain goals and targets in the future, it becomes more second nature to them rather than tracking. And you often see people putting so much emphasis on the macronutrients and tracking them every single day. They can kind of burn you out mentally. So I think that's why, just like Jess said, just using it as an educational tool is probably best for tracking macros.
Yeah.
So I've got a question from the audience, and it was actually just handed to me on a hand-scribbled note from a doctor.
Great.
And not being a pharmacist, I'm incapable.
I know.
I can't actually read it. So the question is, patients with IBD, bowel disorder, inflammatory bowel disease. Do you recommend intermittent fasting?
Okay, cool. I'll start.
Yep.
So as Tom said, we work at the Centre for Gastrointestinal Health with Dr Pran Yoganathan. So pretty much every second patient has inflammatory bowel disease. So for those of you who don't know, inflammatory bowel disease includes conditions like ulcerative colitis and celiac disease and Crohn's disease. So these are quite serious conditions which have an autoimmune component. And they're inflammatory conditions, as the name suggests. And so what we find with these people is they're often coming into us on really healthy diets. So they're coming in and they're eating heaps of vegetables and they're eating regular meals every single day. And they've got like the typical whole food standard approach because they're really motivated patients because they're often quite ill. And so the question was, do we recommend intermittent fasting? So there's a couple of things we would do for this type of patient. It really depends how severe their inflammation is where they come in. But we have found that a good way to lower inflammation is lowering insulin levels. And so there's a lot of different strategies to lower insulin levels. One of them is intermittent fasting. So for some patients, it's easier to, start with intermittent fasting and not have to look at the types of foods they're including, or they might already have a healthy diet, but just giving them more periods of rest where their gut can just have a break from digesting foods and heal, because the gut integrity is impaired. So the gut lining needs to heal and repair. So by not putting foods in the system, you're giving the body the chance to rest and digest. But intermittent fasting is a great strategy for lowering levels of insulin. So this can be a really good way to help individuals with inflammatory bowel disease reduce their inflammation. But we also do other things as well, like elimination diets, and we often look at, these people have a lot of nutrient deficiencies, so we have to address those. So it's not just intermittent fasting on its own. There's a lot of other overlapping things that we would do as well. Did you want to add to that? Yeah,
sure. And just to add, not too much on the fasting part, but in terms of inflammatory bowel disease, I think it is really good for particularly to fast to give the gut the rest as well. It's also important to look at the types of foods and what foods are more fermentable in the gut, and what foods are spending more time in your gut. So, for example, at the clinic, we're trialling a lot of low-fibre diets for people, particularly with IBD, and it's giving them that kind of similar effect as, with intermittent fasting. We're giving them some gut rest, and it's typically what they do, when someone comes out of hospital, you want someone to be on a liquid diet or a low residue diet. So looking at fibre and reducing fibre is another good tip to give the gut some extra rest.
So I've got two questions that follow up from that one. And one is that I'm eating LCHF, but I'm dealing with gastro issues like bloating or reflux and constipation. What changes can I make to improve gut health? And at the same time, follow-up to that question is also with regards to constipation during periods of fasting. What are strategies to deal with constipation during periods of fasting? So we have people with IBD who are trying intermittent fasting with, how do you deal with constipation? How do you deal with those kinds of issues?
Yeah, constipation's a biggie for people with IBD, but for people with just IBS or even people without any diagnosed gut issue. And so to answer both of those questions, and then we can go more into the fasting question. But when it comes to the function of your gut, there's a lot of things involved. And one of the really important things that is involved in your gut, or is crucial for healthy gut function, is electrolytes. And so we know that if you're not getting enough sodium, for example, then you can't draw enough water into the bowel, and your bowel will literally just block up. And also if you're not getting enough magnesium, then your smooth muscle, which is in the gastrointestinal tract, cannot contract and relax properly. And that can cause your gut to block up or have other issues like bloating and discomfort. And so getting enough electrolytes, including sodium and magnesium, is absolutely crucial. And this is on a low-carb diet, but this is also with fasting. When people fast, they still need to think about electrolytes. So a lot of people are just fasting, they're cutting everything out. They might even be drinking black coffee, but they're not thinking about salt. They're not thinking about magnesium. They're not thinking about potassium. And so if we recommend fasting, we generally recommend people think about those things. So for example, what you can do is every hour of a fast, you can just lick your finger, dip it in a thing of salt, put it under your tongue, and then just knock back some water. And that can really, really help give your gastrointestinal tract the sodium it needs. And we do also recommend supplements in cases of constipation too. Magnesium supplementation can be really useful. And we help people find a particular type of magnesium that's going to be effective, and one that isn't going to raise their insulin levels, because when you're fasting, you don't want to be raising your insulin levels, because some magnesium solutions have sweeteners that do. But they would be like my main things that I would look at. But did you want to talk about fats and constipation?
Sure. And a couple of other things. But again, with fats particularly, fats can be quite lubricating for the bowel as well. So often with constipation, I would recommend someone to have some more potential sources of fats, maybe even coconut oil or even typical saturated fats like butters and creams. And that tends to help a little bit and help things move smoothly through the gut. But going back to fibre as well, there's some other tips that I would think about with potential constipation that I give is thinking about trying to remove some of the fibre content of the food. So whether that be peeling your vegetables or removing the seeds as well, or cooking the veggies really well. So that's another good tip. But I do think salt and electrolytes do come into play as well. And like Jess said, I often tell my patients to be really, really conscious of adding salt. And even if they are intermittent fasting and having constipation, they're really probably forgetting salt. And they're probably not accounting for their sodium losses too. So someone's exercising a lot and intermittent fasting, the sodium requirements are going up. And for example, if you're having a lot of caffeine too whilst you're fasting to keep you going, keep you awake, you're probably losing a bit of sodium through that as well. So probably sodium would be my big focus in terms of constipation and intermittent fasting.
And I suppose I'll just quickly clarify. I know we've got a whole session on fibre coming up soon. But so essentially fibre is thought of as being really healthy for the gut. So people usually think when I've got these gastrointestinal issues, I should be eating more fibre. But that's not actually the way that we're supposed to treat inflammatory bowel diseases and IBS. Even in the standard approach, what they do is they put people on a low residue diet when they have these gut issues and when they have fecal loading and things like that. And a low residue diet is a very low fibre diet. So it is quite common practice to reduce fibre during these times of gut inflammation. And then, as Tom said, it gives the gut a chance to heal, and then you address nutrient deficiencies at the same time. And then you try to increase the flexibility of the diet if that person wants to. So if they're wanting to include their veggies again and they don't want to peel their veggies and they want to eat the skin and they want to have raw veggies, then we can start working at building the diet up once the gut has had a chance to rest.
Yeah, there's an evolutionary biology issue regarding salt ion supplementation, salts essentially, and that is that we evolved eating not just the meat of the animal, not just the flesh of the animal, but also drinking its blood and eating eating pretty much as much of the animal as we turn to energy, and it's that drinking of the blood of the animal that we've lost in our diet, and so that may be part of the reason why we have a really attuned salt sensing system. We know when we need some saltiness in our food, and we know salty food is good. And I think part of that has to do with the fact that we've lost that link of being able to get adequate sodium in a natural diet. So people often talk about, if you're eating real food, you're getting enough salt. Maybe not unless you're drinking the blood of your animals or something. So Klingon style. Yeah. So I have a question about practicality, about practical ways and tips for maintaining a low-carb lifestyle when eating meals out of the home.
All right. So eating meals out of the home can be tricky when you're on any diet, right? And so I guess personally, we've been doing this, or I've been doing this for, 5-10 years, long time. And I eat out a lot. So if my friends ask me to go out for a meal, or Tom and I want to go out for a meal, we just go out and we enjoy ourselves. But there's a couple of things that you want to think about. So the first thing to think about is that, there are a lot of restaurants and cafes that actually have low carb friendly options. So, for example, we had grilled burgers last night.
So did we.
Did you?
Yeah, they were great.
Delivered to our house or our apartment.
We had to go pick them up.
Oh, there you go. And so we did the low carb bun that they've got, which is made of almond meal and a few other things. We had the beef patties, we had the cheese, and it was on the menu. It was a low carb option. We didn't have to make any tweaks, so it was really, really easy. So finding places like Grill Burgers that will do low-carb options. Otherwise, if you go somewhere and maybe you didn't have a choice in where you were going, your family wanted to pick the menu or pick where you were going, you can actually look at the menu before you go. So look it up online, look at the menu. So you have time on your own to kind of study the menu and look through what might be the best available option for you. And my biggest tip would be to go for the protein-based dishes, like the steak meals, the fish meals, and those things that are based around the protein. Whereas if you go to the pasta section or the risotto section or the stir fry, it's so hard to actually then find what you can choose, and your meal's going to come out and you're going to be the one that's like picking out the carrots and the beans, and then you're going to like leave all the rice and the good sauce and things like that behind. So there's two ways you can do it: sourcing out low carb friendly places, and then number two, adapting the menu to suit you. And I guess a good example of that is like if you're going to a cafe, we always go out for breakfast on the weekends and we just pick what we want off the menu. Like we just choose the big breakfast or something like that, and then we adapt it. So then we ask for it without the bread, and we say, oh, instead of the hash brown, can we get some smoked salmon or extra avocado? And we're paying them. So we expect that our requirements, our preferences are going to be met, and they usually are. It's usually not an issue. Did you want to add?
Sure. You've summed it up pretty well, and it's basically exactly what we do. But I think looking at it from a more social perspective as well, and thinking that it's totally fine to go out and remove the burger from your bun, and remove the
bread.
the bun from your burger. And I've been following low carb for about a couple of years now, and initially when I was going out with my mates, I'd be the one taking the bun off the burger, and they'd have a little bit of a laugh. And 6-12 months down the track, they're asking me for some tips.
Yeah, they're all doing it.
They're all taking their buns off.
Now we're all doing it. And to add to that, restaurants are really catering to your needs too. So if you want to request something and they want to replace potatoes for vegetables or something like that, every restaurant is pretty friendly and accommodating in that sense. So, and as well, if you want to look at fast food as well, even simple as going to McDonald's and having an Angus beef patty with an egg and a slice of cheese, there's no harm in that, and it's a better choice than a lot of other things. So.
Yeah, we go to Macca's. We came to Macca's on the drive up here. That's what we got.
Exactly, yeah.
The restaurants know this. Restaurants know what people like because they see what people order, but also they see the food coming back. So you can, if you're sitting in a restaurant, you can actually see plates going back into the kitchen
with all the buns,
on them, and the potatoes and the pile of rice and everything else around. They're not idiots. They'll work it out.
Yeah.
And let's just quickly shout out to that meat place we went to, the all-you-can-eat meat.
Which one was that?
In Threadville.
Oh, yes, in Threadville, the Churrascaria.
Yes.
Yeah, the Brazilian meat places. Oh. So these are really cool. They have like a little dowel on your table. One end is green and one end is red. If you have the green end up, they will just keep sending meat to you, and they will not stop. The only way that they will ever stop is if you turn the red up. And you can do that for like half an hour just to take a breather and then get back into it. There is actually a meat place here in Canberra. It's not a Churrascaria, but they're a meat specialty down in Central and in Civic. I don't remember the name of it offhand, but I'll find out what it is.
Everyone can start Googling it. Okay, great. I think we might be
Marble and Grain. Yeah, we are. We're almost done. It's called Marble and Grain.
Marble and Grain.
Yes.
Nice. Sounds great.
We can keep talking. I'll just set the
we'll keep going.
Okay.
Do we have more questions from the audience?
So we have one more question. What do you suggest as a protein snack other than eggs?
Sure.
Bacon.
well, if you're looking for a really good quality source of protein, I tend to go for animal products, so all animal types of meats, and it can be as simple as having a barbecue chook in the fridge and nibbling a leg of that. I think cheese as well is a really good source of protein and sodium too, and calcium. So I think even if you want to just treat yourself to some of these high-fat foods that have a good source of protein in it as well, and use that to your advantage, because without the guilt associated with a high-carbohydrate, high-fat diet. So include sources of cheese, and for example, I would have, some leftover meats, slow-cooked meats are always available. If you have a slow cooker on 24/7, you can pick meats from that, the protein snack. Or, what about you, Jeff?
Yeah, I would agree. Like just making extra meat from your dinner and then keeping it cold in the fridge with some Glad wrap over it, and then just like picking at it. Like that's fine to do. It's what everyone kind of wants to do. Yeah. So that's a good option. But non-meat, non-egg options. So a really good one would be full-fat yogurt. We've got this delicious full-fat yogurt here that Tracy made, but you can get really good full-fat yogurts from Coles and Woolworths that don't have any sugar added. And they're a good source of protein. You could even add like a handful of nuts like macadamias or something like that for some freshness. And both of those foods contain protein. But another thing as well is protein shakes. So this is a little bit controversial because there's a lot of protein shakes out there and protein bars out there that are terrible. They've got lots of ingredients in there that can make you feel unwell in the belly. They can spike your blood sugars. They can spike your insulin levels. But there are still some good products out there that don't contain nasty ingredients, and they are made with good quality whey protein, good quality collagen protein, which is a fantastic source of protein. And so if we help patients find those really good products, and then we recommend having a scoop of protein. You can either add it to your yogurt and like mix it up and make it taste like vanilla or something, or you can actually make a protein shake. And you might make that with like water and a bit of cream, or, you know, you might put an egg in that if you want to bump up the protein and the fats. But that would be another option. Can you think of any others that we've missed?
So tofu is a good one. If you don't like eggs, I make my own tofu. I have a tofu maker, but it's a complicated process, much like making cheese. But it is delicious. Freshly made tofu is delicious. If you can find a store that makes silken tofu that's freshly made, there is a quantitative difference. It's like the difference between getting instant coffee or an espresso. There's a big difference. But the other thing is that don't discount the sources of protein that also have fat, like bacon. I said that in jest, but one of the important things about nutrition is that we are animals, and the organisms that best concentrate nutrients good for making animals is the flesh of other animals, and that includes the fat of animals that contains a lot of fat-based vitamins. And so micronutrition by surprisingly by eating animal fat. Butter is quite nutritious, quite a lot of vitamin K and the like. So don't go looking for low-fat, high-protein snacks necessarily, because I suspect they won't make you feel satiated and you'll be eating a lot of them. But if you go for a strip of bacon with some cream cheese, that is always available in the fridge if you cook up your bacon in advance, and that will satiate a lot of people.
Absolutely, agreed.
I think we've done it. I'd like everyone to thank Jessica and
Richard.
And Tom, and thank you very much. And I think the next talk is Tara. Well, I will hand over to Tara. Thank you very much.
Thank you.
Thank you.
Thank you very much, Jess, Tom and Richard. And we've had a lot of questions come in during that conversation, and I'm making a note of those questions. We do have a question and answer panel later this afternoon, and we'll try and address more of those questions then.